Is there a home treatment for open wrist? Open wrist is a term we use to describe wrist pain or discomfort. Wrist pain can have several causes. The most common are repetitive strain and tendonitis, which can also manifest as Quervain syndrome or carpal tunnel syndrome. In some cases, it may be due to a sprain, trauma, or even cysts. Below, we discuss some treatments you can try at home to relieve the pain. Home treatment for open wrist. The main symptoms of open wrist are pain in the wrist that worsens with movement, stabbing pain, pain that may reach the hand, loss of strength, altered sensitivity, inflammation and swelling in the wrist. Treatments for wrist pain. Here are some tips to help relieve the pain at home. Rest the wrist. Try to avoid moving the hand to reduce pain and give time for the symptoms to subside. Use a brace, splint or wrist brace, to keep the wrist immobilized. This is one of the most effective ways to relieve pain, and braces can be found at most pharmacies. If you cannot purchase one, use a sock to secure the wrist. Wrap the sock around the wrist, pass it between the thumb and index finger, and fasten it around the wrist. Apply ice, with a towel, or a thermal gel pack to reduce swelling and inflammation. Take anti-inflammatory and pain relief medications if the pain is very strong, but only as a last resort. If the pain does not improve within 3 to 4 days, contact a doctor, as it may be a more serious injury requiring steroid injections, physical therapy, or in some cases, even surgery. How to prevent open wrist. The best way to prevent it is to avoid repetitive movements. If you work with a computer, sewing, or another activity that requires a lot of wrist movement, try to take breaks every 40 minutes. Take a 5-minute pause to reduce stress on the area. Do wrist stretches to relax it. One of the most recommended is extending your arm forward. Bend your wrist back to point your fingers toward the sky and the palm outward. Hold your fingers with the other hand and pull to feel the stretch. Then bend your wrist forward, pointing your fingers down, the palm facing you, and pull with the other hand to stretch the other muscles. Repeat by keeping your arm extended and placing your palm outward with fingers down. Hold each position for 30 seconds, repeating 2 to 3 times a day. Squeezing a therapy ball is also a great option for those who use their wrists frequently. If you don't have a therapy ball, you can use something similar to squeeze or do the exercise with a rubber band as shown in the photo below. Place the rubber band around your fingers and thumb and move against the resistance of the band, repeating 10 times. Whenever you feel pain starting, use the wrist brace to help prevent movement in the wrist. If the problem doesn't improve, contact a doctor.